Alright, how you doing?
Good.
My name is Gus. I'm a nurse practitioner student at MSU, and today I plan to be performing a physical assessment on your cardiovascular and peripheral vascular system. Is that okay with you?
Yes.
Okay. Well, first off, I'm going to start by lowering you down, have you laying down. And for most of this assessment, I'm going to have you actually lying down. And for this assessment, I'm going to have your head to the bed at 30 degrees. That's what we're supposed to do whenever we assess the system. So first off, I'm going to start off by actually looking at your neck. I'm going to be inspecting first. And I'm just looking for any pulsations. And I'm going to be actually inspecting your JVP and carotid artery. So right off the bat, I'm going to have you actually look left to me, please. And this is where I'm going to assess your JVP. And first I'm going to identify where your external jugular vein is. I can see it right here. And then the internal jugular vein, which I can't really see because it's so deep, but I can't see the pulsation. And on your neck, it actually looks at a low point down here. And since I see the pulsations and no jugular vein distension, I can actually measure your JVP. And by doing that, or how I'm going to do that, is I'm going to take this card, so where I see the pulsation, before I move on, if the pulsation was really low for the internal jugular vein, I could actually lower the head of the bed, so actually raise it up, and if it was really high, I could actually raise the head of the bed up. Just throwing that out there. And okay, for the point where I see the pulsation, I'm actually going to set this card horizontally to that point, and with this pin light that I have that has a ruler on it, I'm going to set the base at the suprasternal notch. So over here. I'm actually going to measure where they intersect. It looks like it's 2 centimeters, which is normal finding, because under 3 centimeters is normal. Okay. And I'm going to actually have you just look forward, just straight, and I'm going to be assessing the carotid artery, and I'm looking for pulsations again. I see a little pulsation, so now I'm going to actually feel first. I'm going to feel. Right here, I actually want to try on the lower half of the neck. You don't want to feel up right here under the jawline, because if I were to palpate, the carotid sinuses are right there, and I can cause a triggered reflex, lowering your blood pressure and your heart rate. So I'm going to feel this lower half. I might have to displace your sternocleidomastoid muscle a little, and I can feel it. And I'm just feeling for any thrills, and the grade, which is 2+. Which is normal. And now using my stethoscope, I'm not actually listening. I'm going to use both my diaphragm and my bell side. And I'm listening for any bruises. Now to the bell side. The bell sounds really good for listening to any low-pitched sounds, and diaphragm usually for the higher pitch. Well, now I'm going to come to this side to assess this other area, and I'm going to actually have you look to the right. And it looks like the pulsation for the jugular vein is actually at the same point as it was when I was standing on that other side. So it is going to be the same if I measure it, so I will omit that step since I did it over there. And you can go ahead and look forward for me. And same thing, now I'm going to be assessing for the carotid artery. Looking at the pulsations, or for the pulsation, which I do see. Now I'm going to palpate and feel over, again in the lower half of the neck. And it feels normal, 2+. Do not feel any thrills, which is a turbulence and blood flow. And now I'm going to listen with the diaphragm and the bell side on the stethoscope to see if I hear any bruise. So with the diaphragm, the bell side. And I don't hear any bruise. Sounds good. Now coming back over to this side. And now for this next part, I'm actually going to be going to the anterior chest wall, your precordium, and I'm going to be feeling around, and I'm really just feeling for any abnormal movements called heaves or lifts, or feeling for any thrills. And then after that, I'm going to be listening to your heart sounds as I go for any abnormal heart sounds or murmurs. Look, getting ahead of myself. So first off, I'm going to be feeling. So I'm going to start off over here in this valvular area, which is the aortic area, and I'm moving to the second intercostal space on the right sternal border. Moving over to the second intercostal space on the left sternal border. Moving now to the third. Oh, in the second intercostal space on the side that I just mentioned, that is actually the pulmonic area. Moving down to the third intercostal space on the left sternal border, which is Erb's point, and down to the tricuspid area, which is your fourth and fifth intercostal space on the left sternal border. And then now moving over to the mid-clavicular line. And for the female patients, you actually want to have them to make them, to not have them feel comfortable lift their left breast. I'm going to be feeling right here. And throughout the whole assessment, I haven't felt any heaves or lifts or thrills. And this is also the apex of the heart, the mitral area, also known as the apical impulse or point of maximal impulse. And I do feel the pulsation. And if you are having trouble feeling, you can go ahead and look down. You can actually have the patient lean to their left lateral decubitus position, or to the left lateral decubitus position, to try to feel it. But since I can feel it, she is actually just fine. Okay, now I just felt. Now I'm going to actually listen. I'm going to also take, see if I hear any abnormal heart sounds or murmurs. And I would be listening with both my bell and my diaphragm. So start off with the diaphragm. Third, fourth, fifth, okay, now to the bell side. Second intercostal, the right sternal border. Second, the left sternal border. Third, the Erb's point. Tricuspid area, fourth and fifth. And then lift up one more time for me, please. Thank you. Okay, for this next part, I'm actually have you sit up. Okay. That comfortable right there?
Yes.
And same thing, I'm going to actually have you sitting up and then leaning forward, and I'm doing exactly what I just did previously when you were laying down. Listen with both sides. Start off with the diaphragm. Second. Outside. Then lean forward. Outside. I'm sorry, backward. Last time, bell side. One, left side. No bruise, no abnormal heart sounds, or sorry, no murmurs, no abnormal heart sounds. All right, now I'm gonna go ahead and lean back. And now for this next part, I'll be assessing your peripheral vascular system, starting with your abdominal area. And what I'm doing coming in first is I'm inspecting, and I'm just looking for any aortic pulsations. And sometimes you can see them, sometimes you can't. And after I determine that I can't see them, I'm actually going to listen before I palpate. And over the abdominal, or the aorta, looking for any aortic pulsation, sorry. I'm going to be assessing for any bruise, and same thing, listening for the diaphragm and the bell side. I'm going to switch back to the diaphragm side, and I'm actually going to listen around the renal artery, the iliac artery, down to the femoral. And I'm going to listen for both also. Renal, midline the aorta, renal, aorta, and then bifurcates to the iliac, both sides. And I'm listening for any bruise. Bell side. Aorta, it just says renal. Aorta. Iliac. And femoral. No bruise heard. Now I can palpate, and I'm going to be feeling for any thrills. You can actually also, when I press deep enough, you can actually feel how wide the pulsation is of the aorta artery. Right below the umbilical line, or umbilical area. And I feel it. Okay. And now, I'm moving to the upper extremities. So first looking at color, before I even listen or touch, I'm just looking at the color from the shoulder all the way down to the hands. And then I'm going to be putting my hands on you and touching, feeling for warmth. Feel good, I don't feel any increased heat. And is there any tenderness whenever I do that? Okay, all the way down to your nail beds. I'm just checking your cap refills. So as I depress your nail beds, they're going to blanch, but when I release, they should return to peak in yours less than 2 seconds. So that's normal. Under 3 seconds is normal. And then coming back up, and I'm going to be assessing your radial pulse. So checking for at the radial artery for the radial pulse. 2+ is the grade. Now up here to the brachioradialis pulse. 2+ in grade. That's good. Now come over to the other side and assess the upper extremities on your left side. So again, first inspecting. All the way down from the shoulder to the hands. And then feeling for warmth. She does have some skin lesions right here by the left axilla area. Okay, feel good and warm. Checking for cap refills. Same thing. Less than 3 seconds, I would check them all. Now coming up in radial artery, I'm going to be checking the radialis or radial pulse. 2+ normal, and the grade of the brachioradialis pulse. Feels good. 2+ is normal. Okay. Now I'm coming back over to this way, and I'm going to be assessing the lower extremities. So, got her pant legs up, and I'm just going to be assessing, first inspecting, looking at color, all the way down to her feet and to the toes. And I do see hair, so that indicates there's a good circulation to the distal part of the lower extremities. And coming back up, assessing for any edema. She does have some non-pitting edema. And also I should have felt for color first, or color for warmth. And there is warmth, no increased heat. And now assessing for the dorsalis, check the pulses in the feet. The dorsalis pedis, which is on the anterior aspect of the foot. And I can feel it, the grade is 1+. And now around here, around the medial malleus, I'm going to feel the posterior tibialis pulse. Now I can feel it 1 plus. Now I'm coming back up and I'm going to assess the popliteal pulse. So I'm actually going to flex her knee, have my fingers come in behind the popliteal fossa, and kind of wiggle my fingers out till I feel, which I can feel, great at 1 plus, so it's normal. I'm going to lower this one. Now moving over to the left side. Again, inspecting first, going all the way down to the feet, and I do see hair on this side as well, so indicating good circulation. And coming back up, looking at the ankles for any edema, and also some non-pitting edema over here. Any tenderness?
No.
None at all? Okay, now assessing for the pulses. So dorsalis pedis right here, the anterior aspect of the foot. Coming down. And 1 plus, normal. Now coming around to the posterior tibialis. You good? And I feel it. 1 plus, normal. Okay, and now assessing for the popliteal pulse. So I'm going to flex this knee as well. Same thing. Fingers in. So behind the popliteal fossa. My fingers out until I feel the pulse, which I do 1 plus. Alright, now for the last thing on the lower extremities for the peripheral vascular system, I'm going to be assessing for Homan sign. They usually don't do this a lot in the clinical setting, but it's good it'll indicate to use in the clinical setting, because it can indicate if there's a need for further diagnostic studies. So what I'm actually going to do is I'm going to have your foot back, which is dorsiflex your foot while palpating your calf, and you tell me if there's any pain or tenderness in your calf.
No pain or tenderness.
Okay. Coming around over here to the right side, same thing with dorsiflexion of the foot and palpating of the calf at the same time. No pain or tenderness.
No pain or tenderness.
Okay, and then no increased heat or temp behind the calves on either lower extremity bilaterally. So, normal findings. So I would say everything looks good. Thank you for your help. That concludes my assessment on your cardiovascular and peripheral vascular system.
Thank you.
Thank you.